Tonight, for the first time, we are hearing from two former executives in the children's unit at Raleigh Hill Hospital about recent escapes from the facility. Thank you for joining us. I'm Gerald Owens.
And I'm Deborah Morgan. The facility offers inpatient mental health treatment for children between 11 and 17 years old. We've been reporting on the hospital for years, asking questions after a series of escapes since 2021. New tonight, WRAL investigates. Heidi Kirk speaks with former employees only on WRAL who say they were asked to help cover up some of those escapes.
More than a dozen former employees of Raleigh Hill Hospital reached out to us wanting to share their concerning experiences working at this facility. Now, we spoke to two executives with long histories in the healthcare industry to help us understand what's gone on behind these walls.
The medication was used as a threat. Documentation, terrible. I felt like all the staff was overwhelmed.
Two former Raleigh Hill executives describing a system meant to protect children that may actually be harming them.
You're painted one picture, and then when you get in, it's definitely different.
We're protecting their identities as they fear retaliation. One of our first questions, how children have been able to escape the facility so easily. They tell us it happens more than we've been told.
Were you told to underreport or not report escapes?
I was encouraged to put them as found in unauthorized space.
They say the staff is asked to hide escapes by using loopholes in language so as not to turn heads from the Department of Health and Human Services.
They're left vague, so left up to interpretation.
They both describe an environment that puts profits over patients and conceals the practices that happen behind closed doors, threatening medications.
You better, get in line or you're going to get some booty juice, which is what they called it.
They both say these failures come down to one main factor, inadequate staffing.
I think that was a big part of it. Was they had a lot of inexperienced people, and inexperienced people need more training. And you are giving the same amount of training to somebody with 20 years experience as you were to someone with 20 days experience.
We asked Raleigh Hill and Universal Health Services, the parent company, quote, will you provide us a statement addressing former employees' concerns about instructions on handling elopements, staff training, patient-staff ratios, and a profit over patient mentality? In a statement, Raleigh Hill defended itself, saying, quote, to ensure patient safety, Raleigh Hill Hospital is staffed to regulations and staffing is reviewed routinely. UHS has not responded. These employees say the company is also part of the problem.
Do you feel like Universal is set up with the necessary resources for Raleigh Hill to run smoothly?
In my opinion, no.
In my opinion, no.
So these employees left.
If you push too much trying to make changes, you're viewed as a difficult person, and then, the work environment, doesn't feel very welcoming.
Heidi Kirk, WRAL News, Raleigh.
Now, WRAL Investigates interviewed the former employees for about an hour. You can watch longer segments of our conversation on WRAL.com and our social media platforms. We broke this story with a push alert to your phone, so make sure you download the WRAL News app on your phone or tablet to receive updates on all of our in-depth investigations.